A Valley family is taking legal action against a Gilbert mental health facility after a well-known high school football coach died after being given the wrong medication.
That's right. His wife says that he checked in seeking help but never made it home. 12 News journalist Sean Rice is live outside of Copper Springs East in Gilbert. And Sean, this is an absolutely heartbreaking story for this family.
Yeah, Troy and Kribe, it absolutely is. 39-year-old Kyle Slade is a husband. He's a father of 4. He's an assistant high school football coach at Campo Verde High School here in the East Valley. Back on September 28th, he admitted himself to Copper Springs East, a mental health facility right here behind me, to be treated for depression. What happens next, his family says, is unthinkable. A medication mix-up, multiple ignored warning signs, and hours of inaction that ultimately cost Kyle his life. To those who knew him, James Kyle Slade was larger than life, a dad who never missed a game, a coach who led by example, and a husband known for his kindness.
He loved his kids dearly. We have 4 babies, and those are his world. He loves those babies more than anything.
But in late September, Kyle checked into Copper Springs East in Gilbert for help with depression.
It was very powerful to hear him say, hey, I need to go get some help. In that moment, and still, I was so proud of him for admitting that he needed help.
Days later, that decision turned deadly. The family's lawsuit alleges that back on September 28th, a registered nurse hired through an outside staffing agency called out the name James, Kyle's given name, to which he responded to and was handed a cup full of pills. These pills were not what he was prescribed. Instead of Lexapro, Kyle swallowed 90 milligrams of methadone, a synthetic opioid that can kill someone who has never taken it before. Slade's family says the nurse failed to check Kyle's date of birth, never asked him his last name, and never verified that the right medication was being handed out.
Giving someone 90 milligrams of methadone they shouldn't get is a big mistake. But that's not the end of the story.
In a note attached to the lawsuit, the nurse's supervisor writes that he was told that Kyle was only given 9 milligrams of methadone by the nurse. Because of this, Kyle was never transported to the hospital and instead was held at Copper Springs for, quote, observation. 3 hours later, Kyle lay in his room, visibly dying.
He was still savable at that point. And no one Narcans him. They wait for the fire department to get there and start doing CPR and administer Narcan, and it makes no sense whatsoever.
When I saw him, I knew he was in really bad shape. It's one of the hardest things I've ever had to do is, comfort my children in the loss of their dad.
Their lawsuit accuses LifePoint Health, the parent company of Copper Springs East, and its staffing contractor of negligence and cost-cutting that put patients' lives at risk.
I'm angry. I'm super angry. I'm very, very sad. When I think about what Kyle may have gone through in his final hours, I just can't even explain to you how horrible that is to me.
And in a statement to 12 News, LifePoint Health, again, the parent company of Copper Springs East, they told us they're aware of this lawsuit. They would not comment further on specifics because it's considered active litigation. They did tell me they are committed to providing safe and excellent care to every patient that they serve. We've also learned that the Gilbert Police Department has started a criminal investigation into Kyle's death. They, too, would not go further into the specifics of their active and ongoing investigation. We're live tonight in Gilbert. Sean Rice, 12 News.
Yeah, and it makes you think that if they're going to go with a criminal investigation, there may be something else that we don't know yet at this point, because it does sound, if the facts are laid out the way they are in this lawsuit, that negligence obviously is in play here, but what would be criminal?
Yeah. Of course, Troy, and it's important to point out that the bar to prove a criminal case is much different than the bar at a civil case. At a criminal case, it's beyond a reasonable doubt that the prosecutors have to reach in order to prove someone committed a crime, whether that's negligence that can be proven here, even in a criminal realm. And so the bar for civil cases is much lower, and maybe that's why this an active and ongoing investigation is over a month old at this point. And obviously, prosecutors must review the case before anyone is charged. Yeah, we'll send it back to you.
Big loss for that family. All right, Sean, thank you for the report.